Hello students, welcome back to my another video, and in today's video we are going to be discussing the gross anatomy of our vermiform appendix in detail. So first of all, what is appendix? Appendix is basically a worm-like tube or diverticulum. It arises from the posterior medial wall on the posterior side and on the medial wall of our cecum, and it is basically 2 cm below the ileocecal orifice. I'll show you this to you in a diagram. So this is the ileocecal valve which we were talking about, and below 2 cm of the ileocecal valve we have the vermiform appendix. Now we're going to tell about the length of our appendix. It is basically approximately 9 cm in length. Basically it varies from 2 cm to 18 or 20 centimeters in length in different people, but the average length is 9 centimeters. So there are different positions of our appendix. We can tell them as per the strings of the clock. So it is basically in 6 different positions. The first one is the 11 o'clock position, also known as the paracolic position. The second one is the 12 o'clock position, also known as the retrocolic position, and it is the commonest. The retrocolic position is the most common position. The 2 o'clock position, also known as splenic position. 3 o'clock position is also known as promontoric position. The 4 o'clock position is also known as the pelvic position, and the 6 o'clock position is also called the mid-inguinal position. I'll show this to you in a diagram. So this is the diagram. We have basically the opening of the appendix. So these are the 6 different positions. The first one is the paracolic position, which is almost 11 o'clock. If we compare it with the clock, it is basically 11 o'clock in position. And then we have the retrocolic position. It is 12 o'clock. Then we have 3 different 3 o'clock positions, which are also called the promontoric positions. Now we have the 4 o'clock position, which is also known as the pelvic position. Last one is the mid-inguinal position, which is also known as the 6 o'clock position. By the name we can judge or tell the why this name is given to that position. Mid-inguinal means that the inguinal ligament is just below. The inguinal ligament is just below the appendix. So if it is facing on the middle portion of our inguinal ligament, then this position will be known as the mid-inguinal position or the 6 o'clock position. So now we're going to be talking about the appendicular orifice. The valve of Gerlach guards the orifice, which is made up of semilunar fold of mucous membrane. So this is the orifice of our appendix, and this one is the valve of Gerlach. Now we're talking about the McBurney's point. This is another topic, but I'll tell you in detail. Okay, McBurney's point is the site of maximum tenderness in appendicitis. It is a point, if there is inflammation in our appendix, this point becomes prominent or tendered. We can feel it easily. So this is a diagram in which we have shown the McBurney's point. So basically, if we draw an imaginary line between the umbilicus and the anterior superior iliac spine of our pelvic bone, this imaginary line is drawn, and McBurney's point is a point present between the medial 2/3 and the lateral 1/3 of this imaginary line. So this is the McBurney's point, and it becomes inflamed or tendered in appendicitis. Now we're going to be talking about the blood supply of our appendix. The blood supply. In blood supply we have the arterial supply. The appendicular artery supplies the appendix, and it is a branch of ileocolic artery. Okay, by the name we can know the appendicular artery supplies the appendix, and it is a branch of ileocolic artery. Now we're giving the venous drainage of our appendix. Basically 3 veins are draining the appendix. These are appendicular vein, ileocolic vein, and the superior mesenteric vein finally. And in the end, these 3 veins, they ultimately drain in the portal vein. Now we're talking about the nerve supply of our appendix. The nerve supply is sympathetic and parasympathetic. The sympathetic nerve supply is through the T9 and T10 segments of our vertebral column. The parasympathetic supply is through the vagus nerve, and there is another point called the referred pain, which is basically due to inflammation of our appendix, also known as appendicitis. The pain is felt in the umbilicus, so it is called as referred pain. The pain in the umbilicus due to appendicitis is known as referred pain of our umbilicus. Now we're going to be talking about the lymphatic drainage. The lymphatic drainage is through 2 different type of nodes. first one is direct and the second one is the indirect lymphatic drainage of our appendix. The ileocholic nodes directly drain the lymphatic drainage of our appendix. The appendicular nodes are indirectly draining lymphatic drainage.